While Dr. Kipper will answer your questions to the best of his ability, please remember that an on-air diagnosis is not intended to be a recommended course of action. You should consult with your own physician before making any decisions about your health. In Southern California, call 1-800-222-5222. Across America, it's 1-888-790-5222. It's Dr. Kipper and Tilden, the medical show.
It is, and we'll be back to taking your calls in just a minute, but we got from Valley Presbyterian Hospital Dr. Kevin Rice, who's the medical director of the radiology department. How are you doing?
I'm doing great, thank you.
Good, and the reason we played Beatles music before we get into questions about radiology and interventional radiology, one of the questions that were put together for us to ask you that's piquing my interest is, how are the Beatles keeping kosher and the invention of CT related? And I'm looking, David, the Beatles keeping kosher and the invention of CT, how are they related? George Harrison's mother kept kosher and she invented the CT. That's a tough, the kosher throws me. Go ahead.
Okay. This is an interesting one. So the Beatles, they worked, their producer was EMI Records, as you recall.
Yes.
So EMI had all this money to spend, and it's electronics and musical instruments. So the electronic side, they were working with a fellow who was doing research. His name was Jeffrey Hounsfield. So he was working on this CT scan invention. And when he was doing it, for his specimens he was scanning in the lab were cow's brains. Okay?
Yes.
And at first he was getting the cow's brains from a slaughterhouse where they slaughtered them in the traditional manner, and it literally scrambled their brains. So then he went to a kosher slaughterhouse, okay, and he got a kosher slaughtered cow's head, which is slaughtered by slicing through the neck, and it doesn't
mess with the head.
Doesn't mess with the head, exactly, Peter. And then he used that for his specimen to scan in the lab. That's
so kosher. That would be a good trivia question.
I thought the kosher mechanism was to wine them to death.
That's wild. EMI. I didn't know EMI. The record company did other stuff, other research and imaging and stuff. Exactly. All right, so let's start out. What does a radiologist do all day long? What is your day?
Okay, so first, there's a couple of branches of radiology people may have heard of. One is therapeutic radiology, where patients get radiation for some sort of cancer. And the other branch is diagnostic and interventional radiology, where we read, we were just talking about in the last segment, chest x-rays and CT scans, MRI, ultrasound, that sort of thing. So,
and when do you decide? David and I talk about that all the time. When people call in and say, "What kind of scan should I get?" What is the sensitivity level? What's the determination of when you should get something?
Yeah, well, that's a broad question. So it depends really on the patient's condition. And Dave was talking to that other fellow who was having trouble breathing.
Right.
So he had a chest X-ray, which is good for picking up most conditions. But if there's something subtle, like David was saying, you may not see it on the X-ray. You might get a CT scan, get very high resolution
Why
images.
wouldn't you always just go for the CT? If I'm going for a scan anyway, let me go for the scan that the two to the topo de scans.
Makes sense, but you may ask, why do say people buy a regular car? Why don't they just buy a Ferrari?
Because you just don't need it. The sensitivity
level. You may not need it right away.
Dr. Rice, can you explain to the listeners the difference between a conventional radiologist and an interventionalist, and what that means, and actually what you do, and if you had any stories of anything that you've done, in that world?
Yeah. So the conventional or regular diagnostic radiologist may just read these sorts of scans we're talking about all day. Read chest x-rays and CT scans, MRI, that sort of thing, looking for a diagnosis in a patient that may have some sort of problem. And interventional radiology, what we do in that is we're doing surgery, but doing it through a small hole in the patient, just maybe the size of a small needle or even a small pencil. And we can treat conditions, also make diagnosis of various conditions, and help the patient in a much less invasive way than, say, having surgery. Also, the recovery time is much faster.
Do you have an example of something that you did as an interventionalist that the listeners would be interested in?
Sure. I can think of a case Actually, just had recently at Valley Presbyterian Hospital, we had a child, 8-year-old, who was in the ICU, and he had really severe pneumonia in both lungs, bilateral pneumonia, or somebody would call it double pneumonia. Both lungs, really bad infection. He was febrile. He couldn't move hardly. He couldn't get out of bed. Really bad infection. Wasn't getting better in the usual way with just antibiotics, IV antibiotics.
Right.
And it turned out he had empyemas, which are infected pleural fluid collections. And the pleural is the space between the lungs and the ribs. So he had all this pus in there, basically, and that was what was causing the problem. So the original thought was, well, he's going to need surgery to open up his chest on both sides and get that pus out of there to get him feeling better. So, but what we did instead, because a young child, do something less invasive, is I put small tubes in both sides of the chest, and that cleared out the pus, and they were able to flush it out. And we got the tubes out within 4 or 5 days, cleaned that all up, and he got better
almost immediately. How long is that
got
procedure?
out of the ICU.
How long was the procedure? How long did it take to insert the tubes?
Well, we use ultrasound and fluoroscopy guidance, so for each side it took maybe about 15 minutes, something like that.
So not a big deal. And he's under general anesthetic? Or?
Yeah, well, that's the great thing, too. Because it's less invasive, we just do it with like a twilight sleep, like a moderate sedation, it's called. So there's no risk of the general anesthetic. Patient's not intubated, no breathing tube, just
which is great. And are they making big advances in your field? I would think, because of the technology in the EMI people and the combination of kosher and EMI, right. There's no stopping anybody.
Yeah,
but are
unfortunately, EMI they don't really do that anymore. But in the field, it's what we're seeing basically is what I was talking about is going towards less and less invasive treatment of disease because it's much better for the patient, and also with focus on cost containment. It's a lot less expensive just doing it in radiology than a whole operating room and general anesthetic and all that. So that's the direction things are going, I think. With
interventional, is that all the kind of stuff where you can see what you're doing when you go in? Is that inserting cameras, et cetera?
Yeah, well, we don't exactly insert camera. What we're doing is, I can explain it this way, because actually mother asked me, well, what's a radiologist? What do you do? So Dr. Kipper, he looks at the outside of patients to see what's going on the inside, try to figure out what the disease is. What we do is we look out on the inside of the patient and try to figure out what's going on the outside, trying to figure out what the disease is.
So I guess the key there is it getting more sensitive. Are they getting right. Technology, your technology is getting much more sensitive. We can peel away layers and layers and layers.
Exactly.
Because, I mean, one of the, like pancreatic cancer, I mean, what you're trying to do is find stuff predictively earlier and earlier and earlier, especially with certain areas. Are they getting better at that?
Yeah, we're getting better at that. I mean, pancreas cancer, that's one of those challenges because it presents late. But you're asking about interesting cases I had. I had a case a little while ago of a patient with pancreas cancer who he came actually through the emergency department. He didn't know what was wrong with him. He was having all sorts of weight loss. He had lost about 35 pounds. He was yellow. He was jaundiced because his bile ducts were obstructed. And what I did was I actually did like 5 operations on him, incredibly.
And how did you find out exactly what it was?
So, well, yeah, I made the diagnosis because he came for a CT scan, and we saw that he had a mass in his pancreas. And then after that, I did a biopsy of his pancreas, again, with CT guidance. And the way we do that, again, it's not major surgery. It's just with a small needle going through the skin. And when we're done, there's just a Band-Aid, no stitches or anything. So did the biopsy, determined it was pancreas cancer. And then for the part of the treatment of that is I put in a stent across the bile duct that it was obstructing, and that improved his jaundice. He was feeling a lot better, and actually within a few months he gained all his weight back, all his jaundice disappeared, and he did great. And actually there's an interview with him if people look it up on YouTube. If you look at
because you hear pancreatic cancer and you think right away, check please. So that's great. Well, okay, Valley Presbyterian Hospital, Dr. Kevin Rice. You want to get in touch with him? You can link to our site or go to Valley Press. He's the medical director of the radiology department. And thank you very much. And I'm hoping that they keep coming up with stuff that's even much more sensitive, so that we can predictively predictively determine, preventively what we're doing inside of our bodies, so we don't have to be. I don't want to be cut open again. I had it one time; it was enough for me. So thanks for coming in. I appreciate it. By the way, we're going to talk about calcium tests. We're going to talk about cardism for atrial fibrillation. We're also going to play the quiz. We got Kenny Loggins tickets at the Saban Theater. David's got a quiz that focuses on what today, David?
A little bit of everything.
A little bit of everything. So it's a general quiz that covers all parts of the body, from your schmeckman up to your sphincter or whatever, right?
Right.
From head. If you get most of those right, you get to see Kenny Loggins.
If you get none of them right, you get to go to the concert.
Don't say that. 800, we're too easy. 800-222-5222 is the phone number for Dr. Kipper and Tilden. We return in a minute.